I'm Sunir Garg. I'm here in Chicago at the 2024 American Academy of Ophthalmology annual meeting, and I just presented our data on the 96-week results of the PHOTON study for DME. This is the Aflibercept 8 mg versus 2 mg for the treatment of our patients with diabetic macular edema. As you recall, the PHOTON study was a 2-year study that had 3 arms. It had Aflibercept 2 mg, which is what we've had for more than a decade now, given every month for 5 months, and then every 8 weeks per label. And then the higher dose 8 mg arm, patients were given 3 monthly doses and then were extended immediately. They were extended either to 12 weeks or 16 weeks, and during the study they had the ability to be shortened during year 1 and could be extended during year 2. One of the interesting things about the PHOTON study is patients didn't have to be treatment naive. In fact, about 44% of patients had previously treated DME, and we wanted to know whether those patients responded differently to treatment than those eyes that were treatment naive. And what we found was the following. Number 1, it works well for all patients. Number 2, the OCT gets better for all patients. But number 3, for patients with previously treated DME who were enrolled in the every 16-week group, although their visual acuity improved, it didn't improve as much as those who were receiving treatment more frequently. The final finding that we found was that the DRSS severity scores were different between the two groups. People who had previously treated DME didn't have as much improvement on DRS score as those that were treatment naive. There's a few important takeaways from the study. Number 1, our new treatments work really well, and they work really well with less frequent dosing over time. And that's a big deal for all of our patients, but particularly for our diabetic patients who tend to be younger working age adults. Number 2, although it works well for both previously treated eyes as well as treatment naive eyes, if you have patients who had previous treatment, they may benefit from slightly more frequent 8 mg dosing. It sort of makes sense. If you have patients that were enrolled in the study who were previously treated, they were probably enrolled in the study because they may not have been doing as well as we would have wanted with our previous treatment. Maybe their disease benefits from more frequent treatment. Number 3, there's something else going on with these eyes. We know that patients, even when they were adjusted for the severity of the diabetic retinopathy, treatment naive eyes had a better improvement than patients that were previously treated. And it's not just a ceiling effect. So there's a lot more that we're going to learn from this data set as time goes on. So it's sort of amazing to be at this meeting. There's such a tremendous amount of innovation going on. There's a lot of new data that we're getting. We're learning a lot from our previous data sets. And a lot of the things that we're learning today are actually really helpful for my patients tomorrow in clinic, both in terms of helping me take better care of them today, but also giving them a sense of what the future looks like.